Hi, I'm Kerry Clark from Buxton Mountain Rescue Team. I'm here to talk to you today about our response bags. This is bag one, that's the one we're going to be covering today. This is basically our big first aid kit. Okay, so I'm just going to go through everything with you. We carry one of these on the top just as an extra clean field for if you're sorting out dressings or anything like that. All our bags are tagged for checking. We check them every month. If they're tagged with a date and the initial's still on from the original, we know that they've not been used, and also it's to make sure that they're only tagged when they're fully up and running and operational. So I'm just going to pull that tag. There are lots of pockets in these, so I'm just going to talk you through all the bits and bobs. So first of all, we've got a pouch here. All our pouches, for the ease of people on the hill, are all labelled to tell you exactly what's in them, to just help with you when you're actually getting to your casualty. So this first part of the pouch has got cannulation kit, so if somebody's needing fluids on the hill, we've got the ability and the facility there to put a cannula in somebody's arm, give them some fluids through a line. Wouldn't necessarily be one of the team members that would be doing that, but if a paramedic comes up to us or comes up to the casualty and they maybe haven't got all their kit with them, or it's fallen off down the hill, has happened on the odd occasion, we've got that facility there, and some of our team members are paramedics and medical professionals. Obviously, if you're dealing with sharps, you're dealing with needles, you need somewhere to put your sharps, so that's in there as well. And then we've got our main drugs pack, so we carry medication to help with pain relief, to help with asthma, to treat epileptic fits, people having a heart attack, and that's all held in there. Again, there's an aid memoir in there for sort of dosages and contraindications, indications, that sort of stuff. Next big pouch. So in this pouch, it's for people with breathing problems, basically. So people who either can't maintain their own airway or are needing somebody to help breathe for them. So we've got the oropharyngeal airways, or OP airways, Goodell airways is the other name for them, and they go in upside down, turned round, and down they go, help protect the tongue from going back down their throat. We also carry the nasopharyngeal airways, NP airways, and they go up the nose and down into the back of their airway to help support them. So for people who are a little bit conscious, so they're not completely out, they'll tolerate a nasopharyngeal airway, but they won't tolerate a Goodell airway. And then we've got in there as well the bag valve masks. Everything's sealed in plastic to keep it nice and clean, because we're talking about somebody's airway. So this is a bag valve mask. We use this to help support somebody's breathing. We've got the mask that seals around the face. It's squashy, you can put more air into it so you get a really good seal, stop the air from leaking. And then the actual bag itself, so the mask attaches onto here, and then we can assist with the breathing, and that attaches onto the oxygen. So this is all for if you've got somebody who's really quite poorly with their airway and needs some support with their airway. We're looking at suction. So if you're getting the bag valve mask and the airway management stuff out, you must get the suction out. If somebody's only partly conscious, they are more at risk of possibly being sick and some of that going into their airway and causing them a problem. So we carry this really simple, lightweight suction device. That just goes in the mouth where you can see, you don't put it down the back of the throat, and this gets filled up then. Just to help manage that airway. So we're now, somebody maybe slightly less poorly than the conscious side, unconscious side of things. We're looking now at people who've injured themselves. And in here we've got just carry a selection of different dressings. I'm not going to get them all out, but I'll get a few out to show you. So we've got your classic triangular bandage to do a sling, elevation sling, broad arm sling, dressings to help with stopping bleeding. Also got some simple little ampules of fluid just to help wash the wounds out and make sure there's no sort of contamination left in the wounds. We've got our sort of analysis kit, if you like, which is basically different tools to assess people's observations. So we've got a simple SATS probe, so it looks at, you put it on your finger and it tells you what your oxygen levels are, tells you what your pulse is. It's useful, but on a really cold day, people's fingers get cold, they don't have as much blood in them, so sometimes you will get a faulty low reading or not even get a reading at all. So it's got a use, but sometimes we are a bit limited because of the environment. And then we've also got just a simple little pen torch, so for shining in people's eyes, check their pupils, check and make sure they're even. And then in the main bag, the last little pocket, we carry a defib. And these are just really nice, small, lightweight ones. The ones we had before were about 4 times the size of it and probably about 3 times as heavy. Very simple to use, same as the ones you see outside supermarkets. It talks you through, you stick the pads on, and it talks you through when to do your CPR, when to stop, when it's analysing, all that sort of stuff. But really, really easy, lightweight. The team was really pleased when we got these. Just a couple of the bits I've not said about. So we've got tough cuts. So if you've got a really nasty break to your leg, we can get the trousers open to be able to see exactly what you've done and expose the injury, because you can't really treat through clothing, you can't see what you're dealing with. Stethoscope. So we carry some kit that we as team members maybe don't use ourselves, but there's a small proportion of team members or other team members that can use that kit. So we're going to move on now to what's in the front pocket. Along with the drugs that we carry in the main part of the bag, we also carry some more pain relieving drugs in the front pocket there as well, so we've got nice quick access. We've got basic hand sanitizer in the front there, a little drink of water for giving the medication. This bag has got the Casualty care card, so majority of our team members have got a qualification called Casualty Care, so Mounted Rescue England and Wales Casualty Care certificate, and it allows us to splint, it allows us to give medication and teaches us how to assess a casualty and diagnose what the issue is, or at least make the decision how poorly they are. And the documentation side of things is all in here. There's also some information for some of the medications that we carry as well. Any dressings that we use, if we, all the little tags and things like that have come off the bag, we need to make sure they go in a yellow bag, especially sort of used dressings or soiled dressings. Some spare PPE, we've got gloves and masks in there as well. Nice clean field for putting down on the ground, so if we're up on top of Kinder and we're in the middle of a peat bog, we can try and make an area that's a little bit cleaner to work in. We've also got our incident controller high-vis vest as well, so whoever's controlling that scene will be wearing that, so we know exactly who's the person that's in charge of the scene. So the actual bags themselves, we tend to use Agile equipment bags. They're really thick and hard wearing. They're all slightly different coloured, but the actual layout of our bags are all exactly the same. They've all got the same sort of attachment, same pocket configuration in them as well. They work really well for us as a team. And all of our bags are tagged, so we know what vehicle they've come off and we know what bag they are, because our bag 1, which is our big first aid kit, and our bag 4, which is our splinting and other bits that we need to take on the hill, look very similar, but just so we really know exactly which one it is that we're taking on the hill. So if you like this film and you want to see more, please click like on the YouTube channel and also subscribe to help support Buxton Mountain Rescue Team. Thanks.